think that the current status for both circulating tumor cells, or CTCs, and circulating tumor DNA, ctDNA, is that there are great expectations in the field of multiple myeloma. There have been a considerable number of publications showing prognostic value, and I think that the time is now for greater consensus, reproducibility, greater insight also about the clinical application for these biomarkers to be potentially endorsed by the International Myeloma Working Group guidelines and also the International Myeloma Society. I think that the detection and quantification of CTCs has become straightforward, particularly with the broad availability and use of the next generation flow assay developed by the EuroFlow that enables the detection of these cells down to a sensitivity of 10 to the minus 6, similarly to MRD. As for ctDNA, the technology is there. Probably we are still to find the adequate balance between the amount of information and the amount of DNA needed for that information. And I will explain myself. The more DNA, the more information we want to obtain beyond the mutational status of a few genes. I'm thinking on copy number alterations, IGH translocations, other mutations, ApoBec signatures, etc. The more DNA you need. And therefore, the technology may not be there for prime time use for a comprehensive genetic characterization of the patient using ctDNA. I think this is an unmet need because fortunately patients are living longer, much longer. Because of those very favorable outcomes, there are expectations of treatment-free intervals or not pursuing fixed duration treatment until disease progression, meaning that there will be more and more interest in monitoring the patient for longer periods, meaning that traditional ways of monitoring, particularly at the MRD level in the bone marrow, will clearly decrease the quality of life of patients. We cannot think about a scenario in which bone marrow aspirates are being collected every 6 or even every 12 months for a period of 5-7 years. And this creates the unmet need for minimally invasive assessment, and hopefully CTCs and or ctDNA would be candidate biomarkers for those minimally invasive assessments. Well, I think that it's really up to us to show the clinical application. I think the moment it becomes clear that these biomarkers have clinical application, plus reproducible, easy to use, with consensus cutoffs, for example, in terms of quantification of CTCs, then it becomes very easy to translate into laboratory routine practice, particularly the CTC assessment. Perhaps not that easy for the ctDNA.